So did you know that more women die from heart disease than men? Did you know that only 24% of all heart-related studies are actually done on women? And did you also know that women don't always have the same warning signs as men when having a heart attack? Here to give us some answers about the warning signs, risk factors, and what we can do to prevent a cardiac event in our lifetime is Dr. Paula Zahn, a cardiologist and chief of the Women's Health Division at Brigham and Women's Hospital in Boston. She is a pioneer in studying and treating women for cardiovascular disease. It is so good to have you with us.
Well, thank you. It's wonderful to be here.
Let's get straight to these alarming numbers. 1 in 3 women will develop heart disease at some point in their lifetime, and there's one study to suggest that that might ultimately come to 1 in 2 women.
Absolutely.
So, Dr. Johnson, over the years, I've done a lot of reporting with women and heart disease, and they have 2 complaints. One is that they often tell their doctors what their symptoms are, and they find their doctors dismissive. But the other thing you hear over and over again is how different women's symptoms are from men. Can you walk us through some of those?
Sure. I do want to start by saying that chest pain or pressure, the more typical symptoms, are common in both women and men. So we shouldn't dismiss chest discomfort or chest pain or pressure. But the symptoms that are more frequent in women are shortness of breath, nausea, heartburn or indigestion that doesn't go away with antacids, lightheadedness, or just kind of overwhelming extreme fatigue. So we're all really busy. It's more than just your usual fatigue at the end of the day, a real sense of not being able to get up and move.
And what happens if you have an unexplained pain in your back or elsewhere in your upper body? Is that something we need to be concerned about?
You know, the pain that kind of comes and goes and feels muscular is something that probably is muscular. But I think it's a red flag when something continuously happens, that maybe it happens with activity over and over again, or for some reason it happens and it doesn't go away, and it's associated maybe with shortness of breath. Those are the things that really should raise a red flag, especially if you have risk factors.
Let's talk about those risk factors and what puts us at the greatest risk for heart attacks.
So family history, and I think we've been talking a lot about family history, is critically important. Knowing who in your family had heart disease, did it happen young, old, those are important things. Smoking, of course, is one of the most significant risk factors. Being overweight or obese. Diabetes is a very important risk factor for women. The impact of diabetes in women is far greater than in men. So that if you're a woman with diabetes, you are actually considered to have vascular disease or heart disease without necessarily having the symptoms, and you should be treated as such. Elevated blood pressure, once again, know those numbers, and normal is better, so meaning less than 120 over 80. And elevated cholesterol, and that really has 3 main components: the LDL, or the lousy cholesterol, the HDL, the good cholesterol, and triglycerides. And knowing all 3 numbers, and knowing that for women, an HDL over 50 is where we really want to get to. And then a sedentary lifestyle, which means exercise.
Get out those tennis shoes, as Andy McDowell just told us.
Absolutely, every day.
Can women actually prevent heart disease?
Yes, we can. We really can. Now, you know, for some people with a very strong family history, it might end up happening, but by really intervening in all of the risk factors we just talked about, we can absolutely lower the risk of having that first heart attack. And I think the good news is that even if you've had that first heart attack or had the diagnosis, you can decrease your risk of a second event by doing all of those things.
What about baby aspirin?
We had the studies on men, and aspirin is fabulous for men. And what we've learned more recently is that for women over the age of 65, it's beneficial, but it mainly helps prevent stroke in women and not heart disease. So we don't fully understand why. So aspirin over the age of 65, important for stroke prevention, not as much for heart. If you have a diagnosis of heart disease or you have a diagnosis of diabetes, you should absolutely be taking aspirin if you're not allergic to it.
I want to come back to one of the complaints I often hear about women when they speak with their doctors, that they sometimes don't feel that what they're saying is being taken seriously. And we've heard one of the women in our stories say that's what caused her to get another doctor, a second opinion. How many of you have been to the doctor where you've described a symptom where you feel that you were told to sort of ignore it because you could relate it to stress? All right, a lot of folks. And that is a problem, is it not? Trying to make a distinction between a symptom that might be as a result of stress and something that might be much more onerous, like heart disease.
Yeah. Well, you know, it's very hard to attribute a whole set of symptoms to stress. And in fact, we're learning more and more that chronic stress actually can lead to heart disease. So it becomes this vicious cycle. And what I would say is, you know your own body. And if you're having symptoms that are unusual for you, especially if you have risk factors, that those need to be followed up. And if you aren't being heard, then you really do need to get to somebody who's going to sit and listen.
And doctor, a final piece of advice for women about how we can achieve a greater ownership of our own bodies and a greater sense of responsibility about our own health.
Yeah. Well, you know, for women, this is a major issue because we're usually so busy taking care of everybody else that we sometimes don't focus on ourselves. And I do think that focusing on your own health is really about taking care of the family. I mean, if you're not there, who's going to be there? It's really got to start with you.
Dr. Johnson, thank you.